Hi everyone, welcome to Caremark. Today on World Diabetes Day, we are doing a special video series on diabetes awareness. As a part of it, in this video, we'll be talking about a very rare form of diabetes mellitus, which is LADA.
Let's start with what is LADA.
LADA stands for Latent Autoimmune Diabetes of Adult. The name itself suggests that it's an autoimmune disorder, which means that the immune system of your body starts acting against your own healthy cells, and also that it expresses itself in the later years of life. That's why it's known as the diabetes of adult.
Significance.
Why is LADA important, or what is the significance of this disease? Well, basically LADA is very recently discovered form of diabetes, and there's still a lot of research going on it. But to understand why this disease is becoming so important these days, it is needed that we should take a look at how it is different from type 1 diabetes and type 2 diabetes, which are much common forms of diabetes, but also that how it's similar to both of these diseases. So let's have a look.
Here we have a table which shows us the comparison between the three different types of diabetes. Have a look at type 1 diabetes. The type 1 is most commonly diagnosed at childhood, and in the peak age of 5 to 7 years. There is no presence of insulin resistance, but surely presence of autoantibodies, which is the primary mechanism here. Coming to type 2 diabetes, it is commonly diagnosed in adult patients, and there is presence of insulin resistance, but there is no presence of autoantibodies. So in type 2, the primary mechanism is insulin resistance. Whereas coming to our topic of the video, which is LADA, it is very commonly known as type 1.5 diabetes mellitus as well, because it shares its features with both type 1 and type 2. As we can see, it is diagnosed usually after the age of 30 years, and there may or may not be presence of insulin resistance, but there is surely presence of autoantibodies. So here we can see that the pathophysiology of LADA is quite similar to type 1 diabetes, whereas its presentation is quite similar to type 2 diabetes. That's why it is important to understand these differences, as they may prevent misdiagnosis and help doctors and patients with better treatment outcomes. Causes.
Talking about causes of LADA, like any other autoimmune disease, LADA can be an idiopathic occurrence, or it can be due to some genetic predisposition, like a disease which runs in the families, or there has also been some supportive evidence about it being associated with other autoimmune disorders.
Prevention.
Now coming to prevention of LADA. See, LADA is a disease in which there isn't much scope for prevention, because the factors which cause it are not under our control, like the genetics or the age of the patient. So the only thing we are left with is improving our lifestyle. So certain lifestyle measures, like having a balanced diet and adding some adequate amount of physical activity to your daily routine, can help for sure.
Management.
Lastly, talking about the management of LADA. See, the treatment protocol here completely depends on how the patient presents to the physician. If a patient presents in the initial stages of the disease, like when the disease progression has just started, so there is still some beta activity left, there is still some insulin being produced, so we don't need to prescribe insulin right away. We don't need exogenous insulin here. We try to maintain the patient on oral hypoglycemic agents, and also advise them to have proper exercise and a nice diet plan. Then coming to a patient who presents in the later stages of the disease, that is when the disease has gradually progressed, and in such patients the beta cell population is very much exhausted. There isn't enough insulin being produced by the body, so it classically represents type 1 diabetes. So here the treatment plan is same as type 1 diabetes. We put the patient on regular insulin therapy, and the treatment plan is devised according to the diet habits, the occupation of the patient, and we use a combination of intermediate or long-acting insulins, which can be administered via injections or intradermal patches, insulin pens, and various other modalities. But still, diet and exercise remain a very important part of management of all patients of diabetes, all kinds of diabetes. So that's something which is always a part of management plan, and I hope this information was useful. Thank you.